This is Heather Edmonds, Program Associate with the National Aging and Disability Transportation Center. Welcome to the session on multi-model approaches in accessing healthcare services. I'd like to welcome Keita Cole, Senior Volunteer Transportation Network Project Manager and MyRide West Tennessee Director at Southwest Tennessee Development District. She has been employed with the Southwest Tennessee Development District in Jackson, Tennessee since February 2017. Prior to working for the Southwest Tennessee Development District, Keita was a Regional Director of Marketing for 5 skilled nursing facilities in West Tennessee. She has over 6 years of medical marketing experience working with mostly skilled nursing facilities. Keita is a graduate of the University of Tennessee at Knoxville with a degree in marketing. Keita was born and raised in West Tennessee and has a photography business. She is passionate about her photography when she's not working with MyRide or traveling the state talking about the Senior Volunteer Transportation Network. Welcome, Keita Cole.
Thank you so much, and thank you for the opportunity. We are going to talk about medical transportation and how Tennessee is approaching transportation for our older adults statewide. So first of all, we're going to talk a little bit about what is MyRide Tennessee. And so MyRide Tennessee is a volunteer-assisted transportation program operated out of the Southwest Tennessee Area Agency on Aging and Disability, and that is under the direction of the Southwest Tennessee Development District. We are located in Madison County, Tennessee, which is halfway between Memphis and Nashville, so a very rural area, and public transportation is not very prominent there, so older adults getting to where they need to be is definitely an issue. MyRide began providing rides in Madison County in May of 2017. And how we started this program was our state unit on aging, which is the Tennessee Commission on Aging and Disability. They complete annual needs assessments every year, and transportation has ranked as the 3rd largest barrier for older Tennesseans for the past several years, preceded only by health concerns and financial concerns. And specifically for West Tennessee, transportation is the #1 barrier for older adults, and so we realized that there was definitely a need, and we needed to look at how we can get these older adults to their appointments, especially their medical appointments, but also social appointments. So the mission statement for MyRide West Tennessee is to improve the quality of life for older adults by providing courteous and safe door-through-door volunteer transportation to those eligible for the service, enabling them to obtain essential services and maintain their independence, dignity, and quality of life. So that's a very large mission statement. So where we just think getting in a car and going to the doctor is easy, older adults in our area have to plan ahead and have to make sure they have that transportation available to them. So what is the impact for lack of transportation? We all know the main causes of not being able to get to the doctor's office. You consider poor health care, access, and lower health status, so they make less trips to the doctor. But the other impact of not having transportation is socialization. These older adults have to stay in their homes. They may not communicate with anybody outside of their apartment or outside of their home for several days. So that leads to depression and anxiety, which affects their overall medical health as well. So they make 65 fewer trips to visit family and friends, which also leads to poor nutrition. They're not able to get to the grocery store. They're not able to go to a church function where there might be a meal served. They're not able to go to a congregate meal site. So their nutrition declines, which will increase their medical health as well. So there's 59 fewer trips to shop and eat out. According to recent statistic, almost 1/3 of the U.S. population is considered transportation disadvantaged. So over 1/3 of our population has an issue getting where they need to go and the time that they need to get there. Again, those of us that drive don't really think about it because we get in our car and do what we want to. But for those that don't have that opportunity, it's major and it affects their life in more ways than we understand. So how our program works is we have potential riders. So they call in and tell us that they have a need and they need to go to a medical appointment or a grocery store or somewhere like that. And we do a medical screening on them, so we get basic general information on their health conditions, and then we do a complete an application. So that's mostly demographic information. We also ask what type of vehicle they can get in and out of easily. So if they need a higher setting vehicle or if they need a lower setting vehicle, that way we can make sure we match up the right volunteer with that person. Their applications are reviewed by staff, and if they meet the eligibility requirements, then they're asked to pay our membership fee. For my program specifically, it's a $25 a year membership, and then there's a cost per ride, which is $2. We did this in West Tennessee because we knew that that's what our older adults could afford. There are several programs across the state of Tennessee at this point, and each community can decide what they charge. So it does vary some across the state, but most of it is within the same range. If they meet their eligibility requirements and they pay their membership fee, then they can begin taking rides. And if they do not qualify for our service, then we will refer them to another transportation service in our area. We do have several non-emergency transportation providers. We have rural transportation vans. We have medical transportation services. We do have some public transportation, so we don't just leave them without an option. We do want to provide them with other options. So what the eligibility requirements are is they have to be over the age of 60. They still must be ambulatory with minimal assistance. They are allowed to use canes, walkers, rollators, portable oxygen, but we do not transport people in wheelchairs, mostly because we use volunteers, and we don't know what volunteers have access to what type of vehicle. So that's something that we don't want to offer a ride to somebody and then not be able to provide it. So we just have eliminated that one from the beginning. They still must be able to make their own medical and financial decisions. Our volunteers will not go back into the doctor's appointment with them. But so the person has to still be able to understand what the doctor's telling them, be able to manage in their own medical needs. And then they must be able to pay the yearly membership fee and the per ride cost. In instances where someone may not be able to afford the membership fee, we can seek out some scholarship opportunities. Luckily, that's not happened in our area at this time, but that is something we have as a contingent plan if needed. So services that we offer, it is a door-through-door transportation service. So that's unique in the fact that the volunteers will stay with the rider and assist them with getting checked in at their doctor's office. If they need help, our medical facilities recently have switched over to an electronic check-in. So they have iPads that they have to use to check in, and some of the older adults don't understand how to work that. So the volunteers will help them get through that process. They'll help them make sure they find the right place in the doctor's office, if there's multi-level doctor location. We do include pharmacy stops with a medical appointment. As most of us know, typically if you go to a doctor, you end up with a prescription and need to go pick it up. So that is not an extra charge if we need to go to the pharmacy after that medical appointment. And then the volunteers offer companionship, and they assist as needed. If we take somebody to the grocery store, the volunteers will walk through the grocery store with them. They'll help them get their groceries, help them get them home. And then they're just there to talk and have that companionship and socialization. So if you're considering being a driver, what should you expect? So drivers with this program are considered volunteers. They do not get an annual salary or anything like that. They are the heart and soul of our organization. If we did not have volunteers, this program would not exist. They literally drive the program. By utilizing volunteers, we are able to keep the overhead of the program low because we're not paying for drivers, so then we can in turn keep the cost of the rides low, so we don't have to have the older adults have to pay more for their rides. The volunteers do use their own vehicles to transport the riders. They do have an option of mileage reimbursement. I believe across the state we may have 5 people that have requested mileage reimbursement. The majority of the time these volunteers will take their first ride and they realize the difference they're making in somebody's life, and so they decide to keep doing it. We do only ask the volunteers to commit to 1 ride a month, and we do limit the rides to 3 hours. So it is a very small commitment for our drivers, but it makes such a big impact on somebody's life. Volunteer drivers complete an application to ensure that this program is a good fit for their needs and their skill level. We provide them with a job description so they know exactly what to expect. We do motor vehicle checks and to make sure they have a clean driving record. We also do background checks to make sure that we are sending out credible volunteers with our riders. Other online registry checks that we complete are free, and it's what is offered in our state. So we run the abuse registry, the drug offender registry, sex offender registry. We do parole registries, felony offender, and then we check for Medicare fraud, abuse, and different things. So these are all online checks within our state. So if you're in a different state than Tennessee, you might need to check in with your state to see what all is offered. But we do check our volunteers to make sure that they're safe to drive our older adults. The volunteers do go through a training. So we have developed a standardized training that we utilize best practices for the programs. And we review the policies and procedures with our drivers because they also need to know what's expected of the riders so they know how to handle situations if they come up. We go over eligibility requirements for the riders, program parameters, how scheduling works, how funding works, where the money came from, just because we want these volunteers to be empowered with as much information as possible. We instruct them on what to do in case of an emergency. Hopefully that won't ever happen, but we do want our volunteers to be prepared and know what to do if something does happen. We go over etiquette when working with older adults. So we usually have a nurse come in and talk to our volunteers on how to assist older adults who may have vision difficulties, on how to assist older adults with hearing difficulties, weakness, getting them in and out of the car. We want to make sure that these volunteers are there to support the rider and that it's also a safe transition for the rider and the volunteer. So we make sure that we go through a lot of different options on what to do with these older adults and how to assist them. We do go over our software that we use for volunteer scheduling, and we show our volunteers how to look at the rides, how to pick up the rides, how to complete the rides and assign themselves. The software that we use is through an assisted rides program. It's called assistedrides.com. It's a great software training tool, and it's very user-friendly, and volunteers can assign themselves to the rides and not have to rely on being told what works for their schedule. We also talk to our volunteers about being the gatekeepers. They are the eyes and ears for our consumers. So if they notice different things with our riders, maybe they're weaker on one trip than they were before, or if they notice there's some confusion or there's a decline, they can let us know, and then we can talk to the rider, go out and do an evaluation on the rider, or get the family involved. We do get contact information for everybody. So that way, if something is going on medically and this older adult does not have someone living with them, there is at least someone that is keeping a check on them so we can maybe intervene before something progresses worse. So we do have a code of conduct for our riders and our drivers. We do have rules and regulations that we expect both rider and driver to follow to make sure that the program runs efficiently and appropriately. We want to provide the best service possible to our riders, so having a list of best practices helps to ensure the service is accurate. And then riders also have the responsibility to the driver to be kind and courteous, and we want them to take ownership of this opportunity. We don't want the riders to take advantage of this. We want the rider to be courteous and nice and respectful of the volunteer because they are volunteering their time. So there is a level of conduct that is expected from both rider and driver, and they have to sign these codes of conduct. And if at any time we feel like there is an abuse on either side of proper etiquette or anything that has come about, it does lead to the volunteer may no longer be considered as a volunteer, or the rider may no longer be considered appropriate for the program. So we want there to be respect on both ends of the spectrum. Insurance risk and liability is always a huge question. How do you make sure that these volunteers are safe driving around these older adults? So we do take precaution to ensure our riders and our drivers are safe and covered. We offer additional insurance to our drivers through a program called SEMA, and that acts as a secondary insurance to the driver's main primary insurance. In Tennessee, you are required to have insurance to operate a vehicle. So that is always going to be the first line of defense, is the driver's primary insurance, and then the SEMA policy will follow in as a secondary. In Tennessee, we also have a unique opportunity called the Provide Act, where a volunteer who is operating under a legitimate nonprofit volunteer service, they are covered from liability from the state level. So that's another level of protection. And if you see over to the right of the screen, that is our insurance and liability explanation and levels of protection. So you can see how it breaks down from the driver to the organization to the SEMA coverage and then to the Provide Act for the state of Tennessee. So I definitely encourage any state that might be looking to implement this service to research their laws and see if there's a similar protection act in place for volunteers in your state. We also have a statement of insurance and liability. With this statement, we provide it the rider and the driver, and then they have to sign it to ensure that they understand. Volunteer drivers have to provide a copy of their insurance and current insurance card. So every time our insurance updates, we make sure we get that current information from our drivers. We want to make sure they stay compliant with their insurance. And then we update it in the system as it renews every 6 months typically. And then our insurance and liability statement is pictured to the right as well. It goes through the breakdown of research and auto insurance, how it's used, the Provide Act in different ways. Again, this is just to ensure that the rider and the driver has seen this information, they understand this information, and then we're covered additionally to make sure we have informed them of the liability and insurance. So volunteer transportation funding. So how is something like this funded? Maybe a question. So it comes through several different channels. Tennessee was lucky enough to have a funding of a once-in-a-lifetime grant from the Chancery Court in Davidson County, which is in Middle Tennessee. This grant money was used to create the Senior Volunteer Transportation Network. And within this network, it has encouraged us to start 30 new transportation programs in Tennessee over a 3-year period. We've already completed 1 year of the grant, so we're working for the next 2 years. In the first year, we were tasked with completing 10 new programs. We were actually able to launch 11 programs. So the money is used to start these programs, to buy their software, to hire a part-time person if needed, however that program sees fit to work. Other funding that we have is through our State Unit on Aging, which is TCAD. Then we apply for other grants. We do use the membership fees. We ask doctors and businesses to do sponsorships, and then we have also take donations. So sometimes if an older adult has passed away and they might have utilized the volunteer transportation service in their area and they have some money, the family may donate it back to the program to keep it going because it was such a benefit. So funding is always a question, but there's always sources out there to make sure that that funding is there and that this program is sustainable. So for West Tennessee and Madison County, our data is pictured on the slide. We began providing rides in May of 2017, and the data provided shows you from our beginning of May of 2017 through the August of this year, so 2019. As you see across the top, we have 48 approved clients, and we have 42 approved volunteers. We try to keep our ratio at 1 driver for every 2 to 3 riders. That's just to try to keep up the demand. It may vary by area depending on how many riders you have and what their distance is as far as how far they're going. You can see the breakdown of the ethnic group, and then you also see a breakdown of our ride type. So we do a lot of different things besides medical. We do give priority to medical, but we also include grocery shopping. We take people to the gym. We do physical therapy. Sometimes we have some older adults that like to volunteer, so we take them to their volunteer work. But as you can see from the numbers listed, the doctor appointment is the highest one that we do. That is the majority of what we do is medical transportation because it works out well for our riders, but it's also more important for them to get to the doctor than it is for them maybe to get to the beauty shop. However, as you see, beauty shop is a very close second. That is a very important task that our older adults like to do. As far as the Senior Volunteer Transportation Network statewide, this program started with our grant in April of 2018. The grant was for 3 years, and we were granted or tasked to complete 30 new programs in 3 years and provide 15,000 trips statewide. As you can see to the left, how many trips we have provided to date as of April 2019, we were at 20,495. So we were tasked to do 15,000 in 3 years, and we have done 20,000 in a year and a couple of months. So the need is definitely there. The service is a much needed service. Older adults don't like to use public transportation, we have found, because it's not personable. They have anxiety getting on a bus. And so having this second option for older adults as a one-on-one attention has worked out really well. We don't try to take the place of any other transportation program. We're just another option that offers a one-on-one approach to getting our older adults to where they need to go. So how do we address unmet needs? So not one program is going to be suitable for every person, and there are going to be some issues that come up and things that we may not be able to accomplish. So how we look at that is typically most of the programs in Tennessee operate within an area agency on aging and disability. So with these programs operating out of the AAADs, we're able to refer them to other programs that are offered through a AAAD. So if we notice that someone is having issue getting in and out of their house, we can refer them to another program in the AAAD that might help build a ramp, get in and out of the house. Or if we notice that they're having issue with their medication, we can see if there's anything through our Choices program and home and community-based programs that might assist them with getting their prescriptions refilled. So it is an advantage to have it within the AAAD because you do have the other services that are offered. Some of the services that are offered through AAADs include elder abuse, advocacy, medical and long-term care, assistance, Medicaid, public guardianship programs, home and community-based services, and then nutrition. So if we have a rider that has recently been released from the hospital and they're not able to fix their meals, we can refer them to our nutrition program for emergency meals. And so that's another help. So otherwise, these older adults may not have another option because no one knows that they need assistance. And it's not that the family's not involved. They may not have family or their family may not live close. And I'm sure most of you know, working with older adults, they don't like to tell people they have issues or that they need help. They still want to feel independent and do things on their own. So having someone there as the gatekeeper, like we said earlier, is also a good service. Other services that are needed, the programs can refer them to the State Unit on Aging. We can always reach out for other resources if it's something that can't be covered within the AAAD. So challenges that we have faced with our transportation program, like I said, with any program, it's not going to meet every need and there's going to be issues arise. Some of the challenges we've encountered over the last year is volunteer recruitment, having enough volunteers to meet the need. Volunteer recruitment is something that is ongoing for every program. We reach out to all of our civic organizations, to our churches. We do a lot of PSAs on radio and television. The biggest thing that we have found is telling the stories of our riders. So having a rider tell their story on how this program has affected their life tends to help with volunteer recruitment because they see how important it is and they see how much of a difference they can make with just a small task of taking someone to a doctor. Sustainability is something that we're always looking at. How can we continue to keep funding going? So making sure we find those grants, making sure we get those donations, making sure we have those doctors understand that by providing rides to people to come to their medical appointment, that is helping the doctor so the doctor can then in turn help us keep it sustainable. And then the decline in rider health. Again, you're working with older adults, so there's going to be challenges due to facing of decline in health. So we need to make sure there's a plan in place to address concerns. We go out and do reevaluations, make sure that the rider is still continually appropriate for the program and that the driver understands the needs that the rider has. So what makes our program unique? What makes us different from just a regular transportation program? Number one, the fact that we're volunteer-based is huge, and the fact that our volunteers are trained to assist as much as needed. So again, they stay with them at the doctor's office. They help them check in. They wait with them in the waiting room. The fact that we did get the once in a lifetime grant, it was a $3.6 million grant to expand transportation statewide. There is not another state that has tackled this issue as a statewide initiative. There are other programs. I believe there's over 700 volunteer transportation programs in the United States. But as working together as a state to tackle this problem statewide, Tennessee is really trying to set the standard for that and trying to help as much as we can. And then we have a network of individuals who are interested in volunteer transportation. They may not necessarily be a transportation provider, but they have an interest in volunteer transportation. So we're able to have conferences and conference calls and different discussions to see how we can address other issues that might arise out of volunteer transportation. And then again, being associated with the AAAD, we have access to nurses who can do assessments on riders and check on the decline. So that's always unique about our program. So other types of transportation, as I've mentioned before, we do more than just medical transportation. We provide what we call essential trips. So if getting their hair done every Friday is essential, we'll make sure they get there. We do the grocery store, pharmacy, beauty shop, social events. We have several riders that like to go to their church for different functions. We have some riders that like to go play bridge at the country club. That's essential to them because it gets them out and keeps them social and keeps them active and helps combat depression and isolation. So we try to make sure we cover those. Medical appointments are prioritized. So if there are several trips that have not been picked up, we do try to make sure those medical appointments get covered first. And then we will fill in with staff members to make sure other rides as available can happen. It doesn't always happen. Not every ride is guaranteed, but we definitely try to make sure the medical appointments are covered first. So that's how our program works. That's how it's working across the state of Tennessee. My contact information is on the screen if you have questions. We do have a startup guide for anybody who might be interested that does have our policies and procedures, so we'll be happy to share that and to try to help. So if there's any questions or concerns, feel free to reach out and we would love to assist as needed. And thank you for the opportunity.